we'll have a section at the very end for questions and answers. So anything in the meantime that comes to mind, maybe you want to write it in our chat feature or write it down yourself, and we'll give time at the end to answer. Okay. So just to let you know that I'm Dr. Mairead Brennan, and I'm one of the senior clinical psychologists here in Cancer Care West. And also with me today is Dr. Cathy O'Sullivan, one of our other clinical psychologists here in the team. And just an overview, first of all, of Cancer Care West, that we are a charity based here in the west and northwest of Ireland. And someone else came and we're recording. And we've extended our services over the years to meet the needs of families. And in 2007, we opened the residential arm of our service within the grounds of University Hospital in Galway, where adult patients can stay when they're having radiotherapy treatment in the hospital. We also opened our support centre in Galway in 2009, and more recently in 2017, we opened our Donegal Support Centre in Letterkenny. In 2015, we launched our children's service here in Galway to include a therapeutic playroom, both group and individual support, and extended our support to any child impacted by cancer, whether it be a diagnosis of cancer within their family or their own diagnosis. So for today, we hope that we're able to give you helpful tips on understanding a child's experience, how you might notice if they're finding it difficult, and how best to support them, whether you're a parent, an extended family member, friend, or professional, such as a teacher or a nurse who may be involved with the family. And so right now, this topic may feel overwhelming, but the premise for today is to reassure you and validate the work you're already doing. The fact that you're here today means that you're already equipped to support your child or children, that you understand that a child also needs support through the cancer journey. So it's somewhat of a whistle-stop tour today around the aspect, and some aspects of this may not be relevant to you or your family situation at the time. We have endeavoured to give you a little time on all aspects for children and supporting children. In the past, we have got feedback from individuals who have told us that even though some of the slides may not apply to them, that they found that they have helped them to offer advice to others into the future, or even help them to feel more confident that there's certain levels of awareness or understanding in these situations as they arise. So today we're going to look at why do we need to talk to children about cancer, how to talk to children about cancer, supporting the pediatric patient, available supports and resources, and then questions and answers at the end. I will also share these slides with you afterwards so that you'll be able to have them at hand, so you may not feel that you need to write down notes today. So why do we talk to children about cancer? Being in the dark is scary and confusing, and little ones can imagine all kinds of things. They can put color on a picture as they see it and may come up with something completely different. Children are typically attuned to their parents and to their environments, and we don't always give them credit for things that they notice. Has anyone ever thought that they're being discreet about something that they're trying to keep from their child, and that they've picked up on it? In our work here, we've heard from children how they use their imagination to try and make sense of situations and things that they've noticed. Like maybe a phone has kept ringing and mom and dad are whispering or looking distracted or upset. Are they going to separate is one question that might come to mind for them. Or maybe mom came home from hospital and she was feeling really tired. Her hair fell out and she was feeling really sick. It made me scared of taking medication. It made me scared of doctors. It made me scared of hospitals. Or another situation is a neighbor told me in school that my mum had cancer and that her mum had told her, and that I was really confused and shocked. I didn't know what to say and could not cry as I was in class. I was so angry at my parents for not telling me. And it took me a while after that to trust that they were being honest with me. So these are all the little things that children might think of along the way. By talking to them, we can shape their understanding and clear up any misunderstandings or uncertainties they may have. We're letting them know that we are available to talk to about anything that's on their mind or whatever feelings they are having, that we cope with things as a family. The natural instinct of adults is to protect children, particularly when something sad, uncertain, or unusual is happening or has happened. But it's important to include them. We need to talk and involve children in the cancer journey because we know that the impact of cancer is far-reaching and that it impacts all members of the family. Research suggests that family members may have even more psychosocial difficulties than cancer patients. By involving children, we are supporting their psychological health and fostering resilience. Research suggests that children who are told about cancer have lower anxiety than those who are not. Expressing feelings surrounding diagnosis and treatment openly within the family has been linked to lower levels of mood disturbances and enhances a child's ability to cope. Importantly, by involving children and talking about difficult feelings and things such as cancer and talking about emotions that come with a cancer diagnosis, we are teaching children that it's okay and good to talk and express emotions, and we are modeling healthy coping by doing this. And so equipping children with lifelong skills that will help them navigate other life stressors into the future. Importantly, children and young adults want to be included. They don't want to be excluded, and they show a preference for honesty and openness with the potential for ongoing discussion. That includes both a child who has a loved one with cancer and their own diagnosis. Children are very observant. They know that with their stress and changes in the family, as I say, the hushed voices, the telephone calls, and visitors coming to the home, they notice many changes. By deciding that you're going to talk to your children about cancer, you are taking control of what information they receive. They have wonderful imaginations, and their imaginations can be very powerful and not always accurate. It is important that they receive the right information from their family, from their parents. So now, maybe let's look at how we can go about sharing information about cancer with children. And for this, I will pass you over to my colleague, Kathy.
Hi everyone, I'm Dr. Kathy O'Sullivan, one of the clinical psychologists here as well. So apologies for the late start. We had a little bit of technical difficulty, which is of course typical when we have something planned. So thanks everyone for your patience. So as Marie was saying, this is quite a whistle-stop tour of everything. And I suppose from research and clinical experience, really having to talk to children about a cancer diagnosis is an especially stressful part of the experience. Parents can often feel unsure of how much children can understand or cope with, and they find it hard to establish the right balance between telling the truth and protecting children. Both parents and healthcare professionals also often feel as if they don't have the necessary knowledge about how children will react, or indeed how to respond to their reactions in an appropriate way. So while it goes against the natural instinct to protect children, communication with children about cancer in an honest and age-appropriate way has been consistently shown to support children's adjustment and coping with cancer. At Cancer Care West, we find the acronym EARS a helpful reminder of how adults can support children to adjust to the difficult news of cancer. So we can first explain cancer in an honest and age-appropriate way. Once cancer is explained to children, it's then important to listen and create space for supporting children with their feelings around cancer. As adults, we can attune to their emotion, acknowledge and validate it. It's important that we then repeat the cancer story and offer children reassurance. If a child is impacted by cancer, you are too. It's essential that caregivers prioritize their own well-being and self-care. We'll look at each of these areas in turn now. First, we explain cancer to children. In general, it's easier if the information comes from someone who's close to the child. The ideal person would be a parent or a caregiver, and if possible, both parents together. Choosing the time to tell is not always easy. Often there may be no right time. You may need time to come to terms with the news yourself before you're able to explain it to children. It's best to tell children as early as possible, and particularly before any obvious changes occurs, for example, hair loss. Remember, it's okay to say you don't have all the answers. Avoid speaking just before bedtime to ensure there's time for asking questions as well. And choose a comfortable environment where the child feels safe and secure. This could be perhaps at home, during playtime, or when out for a walk. Talking to a child in his or her bedroom may not be a good idea, as this may be the only comfortable and safe place a child can go to afterwards. And we want to give them the chance to create space from the difficult conversation if needed. Finding a way to tell them may take some time and thought. So this is a difficult conversation for you too, and it can help to rehearse what you're going to say in advance. It's important to explain that cancer is an illness. It's important to use the word cancer. Explain how your health might be affected and give simple information on treatments. Avoid offering certainties. It's important to tell them that you're not sure how things will work out, but that you will keep them informed. One way to start the conversation is to find out what they already understand about cancer. Don't make any assumptions based on your knowledge and experience of cancer. Kids can hear stories in school, from the TV, the internet. They may have their own understanding of what cancer means. So this is important to ensure that children have accurate information. And this is an opportunity for you to dispel any myths and offer clarity. Ask them what they want to know. Some children like to have lots of information, others might prefer to know a little less. So follow their lead. The most important thing is that there's clear and honest communication with age-appropriate language. So we will look at adapting language across different age groups shortly. Prepare children for what to expect. Children feel safe and secure when their routine is intact. If there are changes, let them know in advance. Reassure them that there will be someone there for them. It's good if you can name that person. For example, Granny will bring you to hurling training, or Auntie Anne will collect you from school while Mum is having treatment. Invite them also to share the diagnosis with people. Children may want to tell their closest friend, their teachers, the whole class. Some may not want to tell anybody. It can be helpful to share the diagnosis with a few key people, such as their main teacher and the school principal. It's important to highlight that cancer is not contagious, that they cannot catch it, and that they didn't cause it. But there are things that they can do to help, such as tidying away their toys or putting their lunchbox away after school, or maybe even drawing a nice picture for their parent. Naming some of the things that a child can do can help unburden them if they feel they have to do lots. It's important to reiterate to them that they should still go to school and take part in sports and all their other fun activities. And it's best to give a small amount of information initially, give the information slowly, and then repeat it often. So children's understanding of illness and their response to hearing about illness, it will vary depending on their age and their developmental stage. So we'll go through some general guidance on how to tailor communication based on a child's age category now. For children under 5, it's best to use clear, simple language, such as "Daddy has cancer" or "Mommy needs to go to the hospital." Visual aids, such as drawing pictures of where cancer might be in the body, can help make the illness more concrete for younger children. Little ones in this age group can be very sensitive to change. As much as possible, keep routine in place, particularly around bedtime. And for any changes in routine that will affect them, give notice to children so they know what to expect. For example, Daddy's going to hospital tomorrow, so Granny's going to come over and take care of you. For children between around 6 and 9, then they're becoming less egocentric, they're thinking about others, and they'll be thinking very logically. It's important for this age group to identify what they already know about cancer. Imagination and magical thinking can really be at play, so it's important to offer facts and to clear up any misinformation. Again, use simple, clear language using the word cancer. For example, there's something in my body called cancer. It's making me sick. The doctors are giving me medicine to try to make it go away. Developmentally, children in this age group, they do have an understanding of cause and effect relationships. So with this in mind, it will be important to reiterate to children that nothing that they did could have caused the cancer. So around this age, children can also take in a lot more information. And so they might ask a lot more questions and want more information. Remember, it's okay for you to say that you don't have all the answers, but listening to their questions and encouraging their questions with a commitment to open and honest communication, it will be very supportive and containing for children. For preteens then, it'll be important to find out what they already know about cancer and to clarify any myths again. This age group may become more anxious and worried about their health and the health of parents or other adults in their world, because they'll have a better understanding and knowledge of what a serious illness may mean. For teenagers then, they may need time for themselves to process the information and to deal with their feelings. And it'll be really important to give them accurate information, for example, information booklets from the hospital, and really to discourage using the internet as an information source. So once cancer has been explained to children in an honest and developmentally appropriate way, it's important to then allow space to listen to the child, to attune to their feelings and emotion around cancer. Adults in the child support network can help the child by acknowledging and validating their emotions. So we'll take a look at this now. So the most important thing we can do is to listen to the child and to be curious about what they might be feeling. You can help them to identify and name their feelings. Naming emotion can help to regulate and soothe that emotion. You could say things like, I wonder, are those sad tears? Are they angry tears or something else? Acknowledge then, validate and normalize the emotion. Say something like, it's okay to feel sad right now. This is really hard. Some children will have lots of different feelings, and this can be confusing for them. You can let them know it's normal and okay. It's okay to be angry, scared, or sad about all of this. You may feel all kinds of feelings. You'll probably feel happy sometimes too. It's fine to feel all of these things. Importantly, give children permission to not talk about it as well. It's okay to say things, I don't want to talk about it. By attuning to children's emotion and acknowledging it, you're helping to regulate their emotion. You're becoming a container for the child's feeling, helping them to tolerate difficult emotions. Try not to jump into problem solving or fixing mode, trying to take away the difficult emotion, but rather supporting them to tolerate this emotion helps to normalize and validate their experience, and it teaches them an important life skill that all emotion is okay. So when children are expressing emotion, now isn't the time for more facts or information. Instead, show love and soothing, comfort them, ask them if they might like a hug or a cuddle. Remember, it's okay for you to express emotion also. This teaches children that expressing emotion is okay. So how children respond to hearing about cancer will vary depending on their age, their temperament, their family experiences. Children under 12 may act out of character. You may notice changes in their behavior or changes in their play. They may express anger in outbursts or meltdowns. They may withdraw and become quieter than usual. Some children may experience changes in eating habits or changes in their sleep patterns as well. There may be changes in their attitude towards school. Often children will also experience emotion in the body. And so you may notice children having some more somatic complaints, things like headaches, stomach aches, aches and pains in their body. Often these somatic complaints can mirror the cancer patient that's in their world. Some children can also regress, acting younger than their age. Teenagers can also experience a regression, while other teenagers can actually take on more responsibility, and some will adapt more easily to the changes and the disruption to family life. Teenagers may also give the message that they want to be alone, but it is important to encourage them to talk about their feelings. At this age, peer relationships are very important, and teenagers may prefer to confide in their friends. As with younger children, you may also hear more physical symptoms caused by stress, for example, stomach pains and headaches. So with teenagers, it's important to hold in mind that adolescence is a time of change anyway, and it can be really tricky and hard for teenagers. They're already trying to become more independent and navigate their worlds. So changes in mood may not always be cancer related. And with any of these changes and possible reactions, what we can do is create space for children's experience and their emotion, encouraging them to talk about their feelings and to express them. For parents and adults in the child's network, often we can wonder, how do I know if they're okay? What do I need to watch out for? You know your child best, so trust your instincts. Notice, are they acting differently from their normal selves? Are they talking to some people, be it peers, be it a grandparent, another special adult in their life? For peace of mind, it can be helpful to let the school know what's going on so that they can offer a second pair of eyes. Children will naturally differ in how they respond to difficult news. Siblings may react differently, and even children the same age might have very different responses. What's important is that there's open communication around cancer, that they can ask questions freely, and that space is given to emotion and the processing of the news. So now that children have an understanding of what cancer is, and there's been space for them to process their emotion around cancer, it's important to repeat information to allow children to consolidate and to integrate the cancer story. It's also really important to continue to offer children a soothing and supportive space, and reassurance is something that will be very supportive for children of all ages. Approaching communication as something that is continuous will support the child to make sense of their cancer experience across their development. Keep the conversation going. Younger children will need lots of and reminders of what's going on. Older children might have more questions as their understanding of cancer develops. Reassure children that if an unexpected event happened due to cancer or anything else, that they'd be taken care of and that they'd be okay. It can be helpful to identify specifically who would be there for them and who they can go to with questions. So for example, if you have any questions about cancer, you could ask me, or you could ask someone else in the family, like granny or granddad. Reassure them that you'll share information with them and keep them up to date. If anything changes, I will let you know. So let's look specifically then at some of the things that might come up across the cancer journey. So as Mairead said, this is a whistle-stop tour, so in no way means is it exhaustive. And I suppose the key here is really to see that children can be involved in age-appropriate ways at any stage, irrespective of prognosis. At initial diagnosis, explain treatments and what to expect. It's important to use words that they will hear. For example, chemotherapy can be explained as medicine to fight the cancer cells. Surgery could be explained as an operation to cut the cancer cells out of my body. Radiotherapy then could be described as a special laser to help kill the cancer cells. Talk to children about what they can expect as potential side effects from treatment. Hair loss is important to discuss, particularly for younger children, as this is visual and concrete, and they'll benefit from being prepared for this. Explain that tiredness is expected and part of the cancer treatment. For example, saying something like, Mommy's feeling tired because she's using lots of her energy to try to heal her body. For those that are at end of treatment, it's important to create space for cancer recovery. So let children and the wider family know about potential side effects and late effects. For example, fatigue or the impact of hormone treatment. Prepare people in advance. If prognosis is poor, offer reassurance that the doctors will do everything they can to help. Avoid making promises and offering certainties. It is okay to say, I don't know, the doctors are trying. It may be important to shift the conversation from the doctors are trying to cure the cancer to the doctors are trying to keep daddy comfortable and pain-free. Children may ask difficult questions. Be prepared for those what-if questions. We will look at questions briefly next. If there is a cancer recurrence, avoid making assumptions that the child remembers the initial cancer diagnosis. They may now be at a very different developmental stage, and their coping now may be very different. For example, a teenager whose parent experiences a recurrence may not seem as affected as when they learned of their parent's initial diagnosis at age 8. Their reaction to cancer may change as they grow. So for recurrence, start fresh, explain again, match their developmental age, and again, follow their lead. When prognosis is poor and patients are at end of life, it's important that children are involved in conversations around death. Just like conversations around cancer, have open and honest communication. Again, make no assumptions around what children know. They may have no understanding as to what happens when someone dies. Consider they're a blank slate and you can shape their understanding now of death. It's important that they receive accurate information. So we look briefly at some common questions and potential responses now around death and dying. Will they come back? It's important to answer questions truthfully, so be clear and honest. A potential response could be something like, no, dead people stay dead forever. As much as we might like them to, they cannot come back to life. Another question might be, what happens when people die? How you answer this question is really going to depend on your personal and your spiritual beliefs. You may need to probe a little further to check what exactly the child means by the question. You could respond with an open-ended question such as, what do you think happens? That can help you work out what the child is really asking about. They may be curious and want to know about the physical process of dying or what happens to the body after death. Keep your explanations simple, concrete, and honest. For example, you could say something like this. When somebody dies, their body stops working. A dead body does not breathe because their lungs are no longer working and the heart has stopped. A dead body cannot move. It will be very quiet and still. A dead body cannot feel anything, so there will be no more pain. How you explain the spiritual aspects will vary depending on your own belief system. So you may want to explore what the child already believes before explaining your own views. We'll just look at one more now as well. Another common question that you might expect would be, will I die or will you die too? Again, it's important to be honest. Yes, we will all die someday. Nobody knows for sure when anyone will die. It's very unusual or unlikely for someone young like you to die or be so ill that the doctors can't make you better. But we will all die someday, and nobody knows for sure when anyone will die. So it's giving concrete, honest, and clear information. And again, having that conversation. So questions around dying in particular can be very tricky for adults to navigate. And the natural instinct is for adults to protect, but even very difficult truths will be better than uncertainty and confusion. So with this in mind, encourage children to ask questions. It can be helpful to plan ahead, to work out what children might ask, so that you can decide on how you'd like to respond and how much information they need or you want to give. It's common for children to ask a question in the middle of any everyday conversation. It's okay for you to pause, to take a few deep breaths before answering. Try not to dismiss their question, as we want to give the message that they're allowed to ask questions and allowed to talk about cancer and difficult things. It's okay to tell your child that you don't have all the answers. Again, you're modeling positive coping. If any questions are difficult for you to answer and painful for you, it's okay to express emotion. If emotion comes up, you can say something like, Mommy has tears right now because when I talk about Daddy and his cancer, I feel sad. These are sad tears. If you're not sure what your child's questions mean, be curious and you can turn the question back to them. What do you think will happen? Again, we're following their lead and gauging what they already know. Finally, be prepared for more questions when your child has taken in the answers you've given them. So the last part now of our EARS approach to talking to children about cancer really focuses on you and your self-care. So if a child is impacted by cancer, so are you, and looking after yourself is absolutely essential. Identify and reach out for help, establish a support network, delegate tasks. Maybe someone can take on some cooking, someone else can do a school run, a neighbour can arrange kids to be brought to after school activities. Now is the time to lean on the available supports. Give yourself time away from the phone and from conversations. Limit visitors to the house if this isn't something that sustains you. Figure out what your needs are, what your boundaries are, and stick to them. It's important that you take time out for yourself, just for you. Make sure you're taking care of your basic self-care needs. It's important that you also get space to express yourself and make sense of your experiences as well. Share and talk with a partner, trusted friends, family. If you do need formal support, the help is out there. And finally, when cancer arrives, it can impact the whole family and the community around a person. It can feel overwhelming and often become the main focus of conversation and attention. It's good to set cancer aside sometimes, to have some cancer-free time and just allowing yourself to spend time together as a family. I'm going to pass you back now to Mairead, who's going to talk about supporting pediatric cancer patients. So thanks everyone for listening.
So part of our work here in Cancer Care West is supporting pediatric patients, and we liaise with Our Lady's Children's Hospital in Crumlin to do so. We offer face-to-face support for local pediatric patients and their families. And we also offer remote support for parents, patients, or siblings in different parts of the country. Again, different family members may have different support needs and at different stages of the cancer journey. Again, a lot of the previous tips around communication still applies. Evidence suggests that they need to be given the opportunity to be involved in their care and to help to make choices as age appropriate. So again, you want to keep it simple and have conversations gradually. You may need to repeat all or part of what you say several times. Be honest as you can. And a good starting point can be to ask the child what they think is happening, validate what is happening and what might happen next. Again, just as Kathy had said, don't feel that you have to have all the answers. That's okay. You can say you don't know or you don't have the answer right now, and that you'll find out and you'll let them know. And you can also encourage them to ask their medical team to answer their questions. Also, again, it's fine if they don't want to talk. Just reassure them that they're happy, that you're happy to talk about it and answer any questions when they are ready. And again, remember to revisit the conversation as a child grows. They may forget some things that they've been told when they're a little younger. They may have little opportunities along the way to make decisions for themselves, which can be instrumental in them regaining or feeling a level of certainty or control. So this may be something as simple as having them decide what medication to take first. Or with older children, maybe asking them if they would like to manage their own medication. Maybe they want to set up a reminder on their phone around the time so that they have some level of involvement. Let the team help you to talk to them about the medical procedures as well. They already have the language. Don't feel that you have to have all the answers. Asking them means that you're not making any assumptions about what the experience is like for them. So giving them that space to talk about whatever's on their mind is really important. Again, it's down to asking them. Ask them if there's anything that they're worried about. Ask if there is anything they have not been able to ask but would like to ask. This may apply at home or in the medical clinic. You may have to slow staff down and pause to ask your child if they understand everything that has been said. Again, staff are very good at doing this, so a lot of it's already done naturally. But just know that you can give you or your child permission at any time to ask questions again or slow things down. Teenagers may need a certain level of autonomy to feel that they have some level of control and want to make decisions for themselves. So help them to be part of their care team. Many may also feel guilty about the impact of cancer on the family. So reassure them that cancer has come to all of you and that it was nobody's fault. So questions that come a lot in our child service is from parents and maybe how they will help their children to manage some of the behaviors they're having with the effective treatment. And every child or young person may react in a different way. As mentioned earlier, children often express their emotions through their behaviors, and this is quite normal, especially for all pre-verbal and young children. However, older children may also express themselves in this way. At the beginning of investigations and treatment, children may object and they may make clear communication around not wishing to have all the changes occur in their lives, to all the new people and new environments and new treatments that they're having to adjust to. So a change in behavior is not unusual, and it's actually quite healthy that most children and young people do not accept a complete change in their routine, procedures, and lots of new people approaching them with no protest. This is a common occurrence for staff, and they truly understand and are very supportive. And typically children adjust with time. If any behavior continues, such as a procedural distress or medication resistance, it's important to seek formal support. You don't have to manage everything yourself. The team are there to support you and your children. Common side effects of radiotherapy and chemotherapy that affect behavior may include things like tiredness, which is very common. It's likely that a child will feel tiredness during their treatment, and as the weeks go by, this tiredness can increase. This may be because their body is using its resources to repair any damage to healthy cells caused by the treatment, or because of all the journeys to and from the hospital and all the change. Typically, the feeling of tiredness does not stop immediately once the treatment has stopped and could continue for a number of weeks. Learning to take rests or naps when they need to and planning rest breaks into a day can be very helpful. And gentle walks from time to time can also help. Side effects such as nausea or discomfort may also cause distress. And a child may lose some or all of their hair during chemotherapy or radiotherapy. And this can be quite distressing for a child. Knowing that there may be hair loss means that you can plan ahead and prepare the child. Steroid treatment, such as dexamethasone, which is a steroid medication used to treat many different conditions. It can be part of treatment for leukemia, for ALL, acute lymphoblastic leukemia, and to help reduce swelling on the brain for patients with brain tumors, as an anti-sickness medication. And it is an important part of a child's treatment regime. It's typically administered in small doses and for short cycles and may not cause any side effects. If changes in behavior were to occur, children may feel more hyperactive, more emotional, in need of more reassurance and affection than usual, and may be more likely to have nightmares or sleep disturbances, and may be more tired, want to rest more, and can have attention and memory difficulties because they're so tired. It's important to remember that the effects, if experienced, are typically short-lived and subside a few days post-treatment. Treatment refusal may also occur, and I think at this stage, it's important to listen to the child and help them to understand why they're having treatment, but also look at what the function of the treatment refusal might be. What is it that's difficult for them? Maybe they need a little bit of control, so maybe they can, decide on what medication to take first, or maybe they can decide what juice to take with their medication. If it's something that isn't a function of trying to take control and it's something that still persists, talk to your team to help you to manage those behaviors. So, how do I parent a child with cancer? Can I manage behaviors in the same way? Yes and no is the answer. Patience is required and an understanding and accommodating the possible effects of treatment and how it is affecting your child. Managing a child while he or she is receiving or recovering from treatment can be difficult, not only for the child, but for parents and also for siblings. So again, as Kathy mentioned earlier, self-care is important. However, it is also important to maintain as many pre-existing routines and boundaries as possible. These create a sense of stability or consistency for children that is beneficial for them at a time when many things are different. Practical strategies that we share with parents include things like trying to plan fewer family activities when your child is having or recovering from treatment. Give positive attention to your child. For example, praising or rewarding for good behavior. And do not expect him or her to fit in with a busy household schedule, but do not exclude them either. Ask them. Keep a record of your child's mood variations to see if there's a pattern that you can work around, like scheduling outings when they're least affected. If they have more energy because of maybe steroid treatment, allow your child to run around the garden to burn off some of that extra energy, to get them out and about. And ask for help from others to provide one-to-one attention for your child. Maybe giving you time for yourself, or maybe time to spend with your other children, but look for help. Also create rest periods for your child by reading stories or watching relaxing TV or DVDs or listening to music to help them to calm down. Maybe you can use some mindfulness apps as well to help them relax. It's also important to support siblings who may be impacted by their behavior, explaining and preparing them for changes in mood or behaviors and giving them the reason for this. It might be a hard time for them also, and they may need extra praise for good behavior. Teach your child about the effects of treatment and explain it is not their fault. It's because of the medication they're having. And again, it's important to explain this to their siblings too. For steroid treatment, discussing the time of doses with your medical team if your child is having problems sleeping at night is very important. So maybe they may be able to amend it slightly. And of course, the most important thing, as we've talked about already, is maintaining routines and boundaries and being consistent around behaviors. Focus on good behaviors and reward them. It's important to mention something that a lot of parents ask us or have concerns around is fertility. Fertility can be impacted by cancer treatment, and speaking to your child's team around this is really important. A childhood cancer fertility program has been launched in recent years in Ireland and is a consortium comprising of the Irish Cancer Society, Murrian Fertility Clinic, the National Maternity Hospital, and the Children's Health Ireland, with future support provided by the National Cancer Control Programme. And the focus in this program is around preservation, assessment, and intervention, both for pediatric patients, existing pediatric patients, and survivors. Another concern parents have is around cognitive abilities, and our cognitive skills include things like thinking, memory, learning, concentration, decision-making, and planning. They also include processing skills such as recognizing and making sense of information from your senses, particularly sight and hearing. The changes children experience may be subtle. They may be a consequence of tiredness, so they may alleviate with time, or they may be due to the type of cancer, such as the location of a brain tumor, may also have an impact on their cognitive skills. As there are demands on their resources when they attend school, it is important that school attendance is managed well, particularly having a lot of tiredness. They may be less able to use their cognitive skills. And this leads us to talking into when is the time to go back to school. And it's really important to know when you're ready, when the child is ready. Again, thinking about maybe that tiredness, maybe the cognitive concerns, when they themselves are ready, because they may have real drive to go back and see their friends. And so how do you do this in a way that's helpful for them? You'll know yourself when they're starting to feel ready. The medical team will be able to help you with some of that also. And then again, it's asking the child. The school have a role in helping them to adjust back into school. They may have attend school during treatment at different stages. They may attend for an hour. They may attend for a few hours. That's something that you can manage with the support of the school, and also with the support of your child and listening to them. There are resources available for schools as well around cancer and school life. And it's a book and DVD that can be accessed, and it helps schools, it helps teachers and other students and the patient to transition back into school. So it's giving peers an opportunity to learn about what cancer is and how they can support their friend as they return to school. And again, it very much depends on how they feel themselves. They may have physical changes. They may have tiredness and not have the same level of energy to do the things they like to do in school, like playing with their friends. All these concerns can be looked at and explored with the help of the school. Again, we talked about concentration and memory maybe being a little poor or compromised. Again, aids can be put in place, extra time can be given, and it's about helping the child to understand why these are occurring and how everyone's there to support them. They may be feeling emotional, they may be feeling a little bit anxious about returning to school, or have a little bit of self-esteem issues around how will they be seen, how will their peers interact with them, how will they react to me looking different. So again, it's about allowing them to have space to talk about those worries and see how you can as a family and with the support of the school and the support of your professionals to help them to adjust to all these difficulties. Peer relations are really important at this age, and it is maybe allowing them have time with peers through their cancer treatment. Maybe having them call to the house when that's not appropriate. Maybe it's online. So maybe hopefully the connection will be there throughout their treatment, and their friends will also be in the role of helping them to readjust back into school. Again, siblings also may be impacted. They may have a tendency to bottle up feelings to avoid worrying their parents. They may also feel angry or resentful or feeling lonely because of all the changes that have occurred in their house. So it's important again to give them space and to validate that. Again, as Kathy had mentioned, it's really important to liaise with your schools so that they can keep a watchful eye for behaviours. Again, it's going to give you further reassurance that they're doing okay, or that they can be aware of any changes that do occur and alert you to them. Some of these behaviours might be withdrawal or quietness, disruptive behaviour, crying, frustration or outburst, or lower grades. All these things will resolve in time. And it is a symptom of maybe how they're finding it difficult at that time. So it's important to be patient and to explore those difficulties with them and help normalize and validate them. Again, for siblings, just like with every child we talked about so far, openness around illness and treatment is very important. Helping them to understand the changes that are happening as they occur and things that maybe are going to be coming up in the next while. For them to understand what it's like for their sibling when they attend hospital. Again, like Kathy talked about, around chemotherapy, around radiotherapy, around surgery. Again, normalizing feelings and encouraging them to talk. Remind them too of the 3 C's, that you can't catch it, that you can't cause it, and that you can help. So giving them helping tasks so that they feel that they have some level of involvement, both for you and for their sibling. Give them time. Time maybe for one-on-one time with you, and that's the point where it's helpful to have others to help you, to ask for help so that you can give time to siblings as well. Again, be patient with yourself and with them, and seek support for them or yourself as you need it. So now we're just going to take a quick look at the different supports that are available. We encourage professionals to link in as well as needed. It's important for them to know how they can help a family. Their role might be to normalize that a child may be impacted, and that's with siblings too. That they can look out for signs that they're struggling, that they can check in with the family, the whole family approach, and they can signpost to available supports and resources. And this can include therapists working with children, social workers, teachers, and nurses. Formal supports that we have here available in Cancer Care West include CLIMB program, which is a group program for children whose parent has a cancer diagnosis. And it's a program developed in America a number of years back, and it's available throughout Ireland in different support centres. So it's a 6-week program for children, and it uses art and play therapy to help them explore feelings as they're occurring in their family, especially at a time when the parent is going through a cancer diagnosis. Here in Cancer Care West, we have recently developed a new program for children bereaved by cancer, and it's called CUBS. And that stands for Children United in Bereavement Support. And so we're just after finishing our first pilot program the last week. And it's an 8-week program for children who have been bereaved. And it looks at the different feelings that occur for them in that group capacity. So it's an 8-week support program for children. And it's for children aged 9 to 11. At the moment, we'll eventually be extending it out to a wider age range. But for our pilot group, it was for a more narrow age range. And through art and activities, we've helped children to understand the grief process, look at the feelings that occur for them around grief, and learning ways to deal with it. Right. And what we find is, again, almost with the CLIMB and with the CUBS program, that group support is really important. It helps to normalize and validate their experience. Right. We also offer therapeutic play, which is on a 1-to-1 level. We offer young adult and psychological support. And we also work indirectly with parents, helping them with behavioral issues or how to talk to their children around their own cancer diagnosis. And also liaise with schools, supporting them to support children as they journey through cancer, whether it's their own cancer or the cancer within their family. Our children's service also supports parents directly through assessments with parents around the child's needs. Again, as I mentioned, behavioral supports and communication strategies. And there are a lot of local cancer support centres around the country, so it's important to maybe link into your local support. There's a wide range of resources available, both nationally and internationally. These are some of them that we would recommend. Websites including Canteen, which is for children, teenagers and young adults who have a cancer diagnosis. And that's an Irish organisation, charity. Next one is Irish Cancer Society, and they have lots of tips and booklets on speaking to children around cancer, around different cancer types. So it would be information booklets for all family members. Childhood Bereavement Ireland also is a good website for lots of tips on how to talk to children, different resources, as well as a hospice foundation. Bernardo's are also focused on bereavement support. And these two international Click Sargent and Children's Cancer and Leukemia Group in the UK are really useful resources as well. There are lots of videos and apps as well available. And the first three there we would typically share with parents so that they can look over it themselves first, maybe seeing how they can use some of the language themselves, to talk to their children, or else they can watch it with their child as well. So they're really good resources. And also there's another one there called Anna Loses Her Hair, and it's a storybook animation for children from Children's Cancer and Leukemia Group. The last one is Kids Guide to Cancer app. And it's an educational app developed by Camp Quality for children between the age of 8 and 13 who have a parent, sibling, friend, or loved one with cancer. And the app is filled with age-appropriate information about cancer, hospitals, medicine, and treatment. And it also gives advice on how kids might be able to help their loved one, and includes short animated personal stories for kids. It's designed for children and is visually appealing and uses color, animation, and sound effects to answer the big questions kids want to ask. There are a multitude of books available also both for pediatric clients and families. And these are all available free of charge. Some are based out of the UK and some are based here in Ireland. And it's age-appropriate language that can help someone understand maybe their cancer treatment, their cancer type, and different stages of cancer for them. So again, it's both for siblings, or for parents, or for children who have their own diagnosis. Some of the books that we use here and we would encourage families to use are books around feelings. So again, it's normalizing feelings, and I suppose it can be done in a way that feels natural and maybe feels safe for children. Maybe they're not able to put words on how they're feeling or even recognize the feeling they're having. So these books are a gentle way to maybe explore and normalize some of those feelings and help them to maybe see which one applies to them. Tough Guys Have Feelings Too is a really lovely one. And every one of those, it really just normalizes all the different feelings that we can have and different ways that we can cope with them. And really, I suppose, it can be used as a way of maybe opening up conversations, especially if a child is finding it difficult to do so. Cancer-related books are available also for different stages of cancer. So it helps childs to understand maybe what about me? So validating, normalizing, that it may be difficult sometimes when a sibling is sick. Some books are looking at questions and looking to give understanding around mommy going to hospital. Why is she going to hospital? Or why is she having surgery? These are a combination of books for children who have siblings with cancer, parents who have cancer, their own cancer, or another member of the family. So there's a book almost for every type of cancer and situation. These are some of the bereavement groups. And again, it's an opportunity to maybe open up conversations, normalizing feelings, and doing so in a very gentle, non-threatening way.
Oh, very good. So nice one. Oh, careful.
Where are you going?
Oh, nice.
And some books
Right,
may be
like
more
throw
appropriate
it.
for older children. Some of these books are for cancer and some are for bereavement. And some of the teenage books in particular try and give other children's experience or young adults experiences. So maybe experiences that other teenagers can relate to. As I said, we're going to share these slides. So you'll be able to, you don't need to take any of these down. You'll be able to see them afterwards. Now, just to say to everyone, thank you so much for listening. And I'm going to hand you back over to Kathy to set up so that we can maybe answer some questions, if you have any questions that they'd like us to endeavour to answer.
Go.
Hold on a minute.
Hi everyone, I'm not sure if you can hear me on this. I'm just on a different laptop. Naturally, the RT failed this morning, so we're trying to get it up and running. But thanks everyone for tuning in and listening. And we do have probably around 15 minutes for any questions and answers. And if anyone wants to chat in questions, you can do so, or you're more than welcome to unmute your microphone and ask a question as well. We'll stay here until 12:30 for any questions as well. Thanks everyone.
I would actually like to ask a question. Can you hear me okay? Yeah, so basically, I was diagnosed 4 years ago. So I found one of your topics interesting when you were saying that my children were 3, 5, and 7 at that time, and now they're 7, 9, and 11. So unfortunately, I think maybe I had about a year that I had no cancer, but basically it's mets in the breast, and now I'm back in chemo this year. So the kids have been dealing very well with it. Actually, I tie in with John in Cancer Care West in Letterkenny. So my main issue, and it's something that sits with me very heavily, is I've never really mentioned death to them. And I think because I didn't want to put them there if we didn't need to talk about it. I have had 3 monthly scans, and I'll have another one in a couple of weeks. And at that stage, John says, just keep going with your scans to see how things are. Don't make them anxious when you don't need to. So I'm a little bit worried, I suppose, maybe more so even with the 11-year-old. But to be honest, I've taken them to a kinesiologist for their emotions, and they've all been very good. So in fairness, I think they're pretty good in fairness, but it's something that's sitting with me that worries me. Am I not telling them enough?
Sure. And the volume wasn't ideal.
Sorry.
No, that's our end here.
Maybe if I go mute again, no?
No. Sorry, technical difficulties from the start, so.
I just went to look up some of them apps as well, but I couldn't get them, but I'll look at them afterwards then at the names again. I was thinking that they might be useful.
Absolutely. So what is it you would like to be saying to them right now? What do they know, and what would you like to be saying?
So what I've ever said to them is, Mum's on her medicine, Mum's back on her medicine, Mum's hair's gone again, and we just keep going for Mum's medicine. So every time then that my scans come back good, it's like, yeah, doctors are happy, guys, we'll just keep going now again, keep praying for Mum's medicine. So there was somebody, like, they do know that you can die from cancer. They've had, like Granny has said about such and such down the road dying, and you're kind of like, you don't really want them hearing too much, that kind of way. So I spoke to the kids the last day because Granny said something about somebody else, and I said, you can die, guys, from cancer. I says, but that lady was very sick, I says, and she didn't get to get any medicine because of her COVID. I says, but my doctors are trying to give me as much medicine as possible, and that's just the way I'm dealing with it. But I haven't gone down that step of, that Mum might die from cancer.
Sure.
And I don't know if I'm doing good or doing wrong by doing that after today's talk. Do you know what I mean?
Well, what I would say to you is, it's just being age appropriately honest. Have they?
Yeah.
You?
No.
Okay. Well,
my little 7-year-old came home from school. It was actually his friend's mommy said it to me. He said to the friend said, oh, is Breda going to die from cancer? And the mum was all taken back. And she was like, no. So he obviously must have said something at school, but he was the one I was probably least worried about because he was 3. So I felt he's always grown up with me being at home or me going from it. Like, we'd be very vocal and we'd be very much Mum's going away now. We don't hold things back from them. It's just the whole death thing. But he did say out of the blue, and he would be an out of the blue person. Can you speak to somebody? Can you speak to a mammy in heaven? And I was like, well, some people don't, but they might go visit the grave, but they still talk to them. So obviously there was something going on as we had. And I said to him then, I said, have you anything to ask, Mammy? No, no. And then that was him, away he went. But that would be the kind of him, he would come out with random stuff, you know.
Sure.
But that was at the kitchen table, at the 5 of us at the kitchen table. And we've had a friend's daddy who died from motor neuron. And I just said, you know, Heidi goes to visit her daddy's grave, and she talks to her daddy there. And that's the way I left it, you know.
Sure. And I suppose the important thing is that you don't tell lies. You know,
No.
if they were to ask you directly, I would say the best thing to be saying to them is, you know, the doctors are doing everything.
Yeah.
And they're working really, really hard. And
Yeah.
that you hope not, but that you can't promise them.
Yeah.
But, you know, and then that's the part where you give them the reassurance, but the doctors are doing everything they can.
Yeah.
And if things are to change, you let them know.
Yeah. And I think I'm due my scan now next 2 weeks time after this chemo volt. And I think I'll leave it till then and see what comes out of this scan. And it'll give me that wee bit more of a kind of an answer for them. As you say, as John said to me, he says, but Brady, you can't answer something that you don't know yourself. And that's, you know.
Yeah, and that's the part around, like, you know, it's validating the question. That's a really good question. I'm glad you asked, so that we're always validating that it's okay to ask questions, but that you may not know the answer. And even to say that to them, I don't have the answer for you. If I do find out the answer, you know, or things change, I will let you know.
Yeah, yeah. So no, that's okay. Yeah, so it's just it's something that's sitting with me sometimes that I don't. Are we being vocal enough? Do you know what I mean that way? Yeah.
Well, it's take you at their pace, and that's the important part. Is, you know, if they haven't asked, then maybe haven't considered that yet.
Yeah.
But, you know, the important thing is always be open to questions, and that's then leads into, that's a really good question. I don't right now, I don't have the answer. Let me find out, or let me think about it, and I'll come back to you. So, you know, so that you always use that strategy for yourself to give you space, and then you can go and think about the right way of wording it.
Yeah.
But it's just not telling them any lies, because I think what happens then is they don't maybe come back to ask more questions because they're not sure if you are able to give them the answer.
Yeah.
You know, or they find out in time that, you know, you told them an untruth, you know, they mightn't trust your answer in the same way.
Yeah. Perfect. Thank you very much. Yeah.
Thank you. No, so sorry, now with technical difficulties, we're popping back to another computer again. Can I use this one?
Yep.
Okay.
So we have some other questions in the chat as well. How would you explain to parents why it's important to use the word cancer? I suppose really the reason we want to use the word cancer is because children are going to be hearing this word likely at home anyway, from perhaps hushed conversations between other adults in the household, overheard on, let's say, the phone, for example. They might hear it in school as well. So they might be confused as to what cancer means. And because children can be magical thinkers and have wonderful imaginations, they might have misinformation around cancer. So really this is an opportunity to debunk any myths and to give them accurate information. We're controlling what information we give them so that we know that it's accurate.
Someone asked around the apps and the website, and as I said, we will share the website or the presentation with you afterwards. Maybe not today, it might be later on in the week, but you'll have access to all the different resources there then. So hope that's okay. Then someone asked, is pediatric cancer covered on Cancer Care in Cancer Care West in Donegal? And I suppose no, there isn't direct access there. They don't have a children's service set up there, but we can offer it here. I suppose one of the benefits of the pandemic is that we started our remote service. So now we offer a blended support. So I have actually supported children from different regions of the country who may be going through their own cancer diagnosis. It really is very much dependent on the child, dependent on their age and their capability to do video support. I can share resources with families as well, so that maybe we can use that in our video session, or else it may be they're working directly with the parent if the child isn't able to use remote support. So it very much is child dependent, and we can assess that. So what I would say is you can ring here in Galway Cancer Care West, and that we can assess, we can screen and assess your child's needs and what would be the best possible scenario for them, the support for them. I have another one that I've been very honest with my children ages 3, 7 and 9 about my cancer diagnosis and treatment. It's been almost a year since I was diagnosed with breast cancer. I see how anxious and worried they get when I'm not feeling well, like last weekend. Is there anything else I can do to reassure them? I know they have spoken to friends at school about it. I feel like it's been even more difficult for them because of the impact of COVID and services throughout the year. Absolutely. And I suppose it really is to give them an understanding of maybe why you're feeling unwell. I suppose, again, I'd like some more information. I wonder if it's because of treatment that you're feeling unwell, or what is the reason for feeling unwell. And I suppose if it was treatment, I would say educate them around treatment being something that causes tiredness or causes nausea, and that because of this treatment, you need time to recover, and that makes you very tired. It is almost like, that cellular repair takes a lot of energy, so that they understand it's almost affected a treatment rather of feeling it's the disease that's causing it. And so I don't know if you want to give some more information, if it's around that, the reassurance that tiredness is because of treatment. I don't know if you want to give us more information on that, or if that answers your question. And another one was, can you give any suggestions on how to start a conversation with kids to tell them their mom has cancer? It really is, I think, first of all, if you looked at some of those apps, so you have some of the wording yourself, it really is about finding a time sooner rather than later, because as we said, it's really important that they don't hear from someone else. And it can be a conversation that we almost want to postpone, and because we don't know exactly how to start it. But it is about maybe creating a quiet space where there's no other distractions, where if it's you and your partner, whoever it is going to be there to help support you to have that conversation. Maybe tease out the conversation together first before you share it with the kids. It really is about making it age appropriate and giving them a small bit of information. So it might be something as simple as saying, I need to talk to you. You may have noticed that mum has been going to the doctor and or has been to hospital. And the reason that she's been there is because they have found some cells, and these cells are called cancer cells. And then you could actually have a piece of paper where you draw out the figure of a body and you put where the cancer cells are. But it is about giving a little bit of information and leave them think about it and process it. So really slow it down. I think we have a tendency to think we need to have so much information at hand. We're almost over-prepared, or we're thinking way down the line because we want to make sure that we don't stumble or fall over what we're saying. But it really is, think about their development level. Their prefrontal cortex maybe not be developed yet, so they don't take in the same information that we take. So it really is slow it down. There's something we need to tell you. Mum's been at the doctor. Wait and see what they say next. So then you're getting their information. Then you're telling them that the reason that she's been seeing the doctor is because they have found something called cancer. Do you know what cancer means? So it really is slow it down. Take their pace. You don't need to have all the answers. Again, it's about saying to them, this is occurring. We can talk about it. It's okay to talk about it. Every question is okay. Mom and dad don't have all the answers all the time, but we'll figure it out together. So ask questions, take time to think about them and answer them. Okay, just slow it down. We have another one here. We never told our then 3-year-old about my husband's diagnosis. Husband is now stable. Well, should we tell our son, who's now 5 at this stage? What we find is that it is helpful, absolutely very helpful to tell them, because we just don't know when they'll find out or how they'll find out. I've actually had children who have, as teenagers, found maybe some letters in the attic or something that has let them become aware that their parent had cancer, or somebody else in the family maybe mentions it without thinking. And so again, it goes back to them feeling excluded from the event. And so it's never too late. I think it's always important to tell them. And it might be by saying, you know, I was worried on how to tell you at the time, or, you know, I didn't want to worry you, so that's why we didn't say it. But now that I'm thinking about it, it's really important that you know too, so you can ask questions. So yes, I would definitely say would be, get a few bits of wording for yourself and make it simple and leave them ask questions.
And there are some fantastic resources on explaining brain tumors to children as well, if that's the diagnosis, I think. So if you want, you can link in with us, and we're happy to share on those resources as well.
Absolutely.
So thanks everyone for all the questions. We hope that was informative, and as Marie has been saying, that it gives you, I suppose, the confidence in yourself to know that you have all of it already to have those conversations with children. I suppose we're sorry that there's been so many technical issues on our end. I hope it wasn't very clunky for you as an audience. It felt a little bit clunky on our end.
Stressful.
But I'm very happy that you all linked in, and that I hope you all got something.
I'm seeing another question there from someone saying that answered my, okay, it was, I had Herceptin at the beginning of last week and I'm still experiencing side effects from chemo and radiation. Would it be good to use introduce a book like The Big Bag of Worries and use them as a guided tool when talking to them about their worries? Absolutely. It can be those, you know, a lot of those emotion books can be a really nice, safe way to maybe introduce the topics, because it really is, children maybe don't have an understanding of how they're actually feeling or the language around it. So these are lovely, gentle ways of getting them to understand it and build those coping strategies for life. And I think it's really important to explain the side effects of treatment to children, because otherwise you might run the risk of trying to mask it yourself and keep going, which is not, you know, is not helpful for recovery, but also for them to understand the side effects are because of their particular treatment, and that maybe it's not the disease that's causing those effects, but the treatment, and recovery is an important part of that. So for them to even know that mom needs to rest means that they can go, well, can they do anything to help? Can they be a little bit quieter? Can I go get mom a cup of water, or whatever it is to be helpful in it, so they feel part of the experience. And then also I think it helps them to understand that if they get any tummy aches or if they feel sick, it's not the same. It's not the same as what you're experiencing, and that not all medication is going to cause those effects, because they might not tell you about little pains, which may be worry pains, because they're worried that they might have to take medication, and will that medication cause them to lose their hair or to feel sick or really tired? So it's really, again, giving them that understanding is very, very important. Now, if anyone has any further questions after today, we're available here to you in Cancer Care West. So you can call up directly. Our number here, and we'll share it with you anyway in the slides, is 091 540 040. So any questions or any access to resources, don't hesitate to give us a call here. Okay.
Okay, so thanks everyone. We'll leave it there, and as Marie said, do link in with us if you want any resources or want to ask any further questions. Someone asked, will you send a link for recording? We can do, yeah, we can do a course. Yeah, that's a great suggestion. Thank you for that. Okay, everyone, have a good day and take care.